Okay, I'm delighted to say we are joined by Dr. Robert O'Connor, who is Head of Research at the Irish Cancer Society. Robert, we've been talking a lot today and a lot of excitement about the new drugs available for CLL. How big an issue is access to drugs in Ireland, do you think?
I suppose it's a growing issue, and it's a multidimensional issue, really. And I suppose I would advocate that we need to look at this as part of a bigger picture of improving access to world-class healthcare, and we need more investment in healthcare to be able to do that. We need to invest in doctors and high-quality nurses. We need to advocate to our political representatives when they come to the door and let them know we demand a better healthcare system. But specifically in terms of access to new medicines, it's a very complex area. In Ireland we have a regulatory process that looks and examines what's called the Pharma Economics. So it takes into account the value that a drug can give, the extra value. But that hasn't really been informed by patient views, it's been more an economic analysis. So I suppose there are opportunities for patients to engage there with the groups like the National Centre for Pharmacoeconomics. And I suppose we need to be cognizant that there are a large raft of new, very promising agents coming through. Some agents don't give benefit to all patients, and that can be a challenge. So the industry, I think, also needs to react in looking to processes that guarantee outcome rather than costly drugs.
So good old-fashioned advocacy, lobbying is what's needed.
Advocacy, and I think we've seen it in other areas of our society where people getting together and saying, I want better, to the representatives. Ultimately, the political representatives set the scene. It is going to cost money, that is the reality. New advances in medicine, new advances in surgery, etc. These things are going to cost money, but we want them. Our population is getting older. We have treatments now for diseases that were rapidly fatal years ago. So if we want to keep that progress, we're going to have to invest in it, we're going to have to do it very cleverly, and we're going to need to put the patient at the centre of it, not on the outside.
Okay, Dr. Robert O'Connor from the Irish Cancer Society, thanks indeed for talking to us.
Thanks, Shane.